and welcome everyone. Today our topic of discussion is the healthcare system in a foreign country, Sweden. And here to bless us with knowledge of Swedish healthcare is our friend, Raymond A.
Hi, Freddie Fish. I'm glad to be here.
Good. Me too. Now, Ray, can you explain to us the basics about the healthcare system in Sweden?
Yes, I can. And I will. See, in Sweden, there's a system that covers the whole resident population and is predominantly tax-based. It's publicly operated with 3 levels. Voluntary insurance is limited and gives supplemental coverage. The system was socialized in 1970 when a 7-crown patient fee was established. Today, there are small user fees of 100 to 250 krona, meaning it isn't entirely free.
Jinkies! How interesting. What are those 3 levels all about?
You shall be told by me. You see, Freddie, the first is the national level, where 3 organizations oversee things. The National Board of Health and Social Affairs, the National Board of Health and Welfare, and the National Social Insurance Board. Then there's the regional level, which is responsible for healthcare services. Elected county councils are the ones who finance and provide these. The 21 counties of the nation are grouped into 6 medical care regions. Finally, the local level has 290 municipalities delivering and financing social welfare services, such as child care, school health, care of the elderly and disabled, long-term psychiatric patients, and public nursing homes and home care services.
Are you for real?
Totally.
Cool. So tell me more about who is covered.
Care is free for those over 65 and under 20.
How can someone be over 65 and under 20?
I meant or.
Oh.
Yeah, child clinics offer many services free to kids under school age. Maternity clinics give checkups free of charge, and aside from residents, some who use the health services at subsidized prices are emergency patients from European Union or European Economic Area countries, or another that Sweden's got a special agreement with.
Awesome. Next question for you. How much does it cost per person?
Maybe I should first tell you that $1 equals about 7.7 million crowns or krona, the Swedish monetary unit. So then a hospital stay is about $11 a day. Fees for consulting doctors, hospitals, therapists, and nurses range from about $7 to $40 depending on which of those you need. There's a large benefit system for the sick and a high cost ceiling that limits personal expenses. After someone pays about $117, they're entitled to free health care for the rest of the 12-month period.
Tell us about waiting lists for surgery.
Well, like Canada, Sweden's had a tradition of these waiting lists, because guidelines for seeing doctors quickly haven't actually been enforced on regional authorities. The national government has, however, pledged more money to reduce the list, and modern-day internet tools can help people if they're willing to travel to another city for a shorter wait. In fact, Stockholm has greatly improved. Their lists are now shorter compared to everywhere else, and there's a guarantee of your operation within 3 months, or you're entitled to any place with quicker access, either abroad or in Sweden.
That's really neat.
I rather thought so.
Now, you need to tell us about the prescription drugs.
Well, in 2002, the Pharmaceutical Benefits Board was established to decide which preparations should be subsidized and negotiate the cost with manufacturers. According to Sweden's social insurance scheme, a patient pays the entire cost up to 900 krona, or about $117. Above that, there's a rising scale of subsidy, with a high-cost ceiling, meaning they never have to pay more than 1,800 krona, or about $234 in a 12-month period. How do you think all this compares to your healthcare system in America, Freddie?
Cornflakes, Ray! They are very different indeed. Basically, Sweden is socialized, while the U.S. has a free market system. Over here, insurance is a huge part of it, meaning that people either pay a lot to the insurance company or a large amount if they don't have it. The socialized system means there's a cap on everything, with the same cost for rich or poor. The American system doesn't have levels comparable to the 3 you described, and waiting lists are normally only for transplants. No one is free, but if you have insurance, it can cover anyone. Also, you have a co-payment for prescription drugs, and a choice of generic or name brand. That's a similarity. Of course, if you're uninsured, you'll want the generic drugs.
You know it, Freddie.
I think that just about wraps it up for our education about the healthcare system of this foreign country today.
It's not foreign to me.
Whatever. Thank you, Mr. Ray. And one last question. Does all that stuff we just talked about also apply to Swedish and American humans? Or just sea creatures?
Yes, I believe it does, Freddie.
Excellent. Thank you, Ray.